Okay, our first presenter is Dr. Diana Romero. She's a professor in the Department of Community Health and Social Science and the director of the Maternal, Child, Reproductive, and Sexual Health Specialization at the CUNY Graduate School of Public Health and Health Policy. And she has diverse research interests, including social welfare policies related to the health of poor and low-income families, healthcare access among underrepresented populations, and reproductive, maternal, and child health. And much of her research involves mixed methods study designs, including extensive community engaged participatory approaches. And Dr. Romero also serves on the NYC Department of Health Advisory Board for the CDC Pregnancy Risk Assessment Monitoring System and has served on the board of directors of several nonprofit organizations. So, Diana, it's all yours.
Thank you, Matilda. And thank you all for attending. It's a little bit of a delay. I think, let's see if I can advance. Uh-oh. I'm not able to advance the slide.
Giselle, could you?
Were you able to could you try the arrows at the bottom?
That's what I'm doing.
Oh, and it's still not advancing. It worked when we tried it.
I know it did.
Jill, could you please help move to the next slide?
Yeah, none of the arrows or
As
my
you're
mouse.
controlling the screen. There you go.
Okay. So thank you all for attending this conference. I fit into the category of sort of a research pursuing a new research direction, and I really appreciate the pilot funding to do so. I'm presenting on behalf of myself and a colleague, Ansley Hobbs, who's a doctoral student at the CUNY School of Public Health. And this project focuses specifically on child welfare workers experienced with secondary trauma and related conditions like burnout, for example. Just quick background, professionals in child welfare and related fields experience very high rates of secondary trauma-related conditions like compassion fatigue, vicarious trauma, and burnout. The quote-unquote solutions that are most advocated in the literature or described in the literature have focused largely on individual level interventions where organizations may emphasize self-help approaches to workers like yoga and meditation and mindfulness. There's been very limited research on other approaches at a more organizational or systems level, and that's something we wanted to explore with individuals in the field, professionals, as well as to what extent collaboration across sectors might also be beneficial. So that kind of is a quick background. It doesn't look like I can advance the slide, sorry to say.
Yeah, Giselle, why not?
Okay, I'll move forward.
Yeah, please take back the control and you will control.
Okay. If you could advance one more. This just quickly presents a framework by researchers who actually looked at how organizations might be able to address secondary trauma of professionals in their agencies. It is actually in the minority in terms of literature around addressing secondary trauma, but I just wanted to share quickly that there has been some preliminary work along these lines, more at a systems level, and I've tried to bring a public health lens to this work so that it's very much more at the organizational systems level and less so at the individual level. So there's some work, but not very much there in this field. Next slide, please. And again. Okay, so the aims of this project were to actually exactly do that. Look at occupational impacts of working within the child welfare system on mental health, secondary trauma, and other related conditions. And again, from a larger systems or organizational framework. A particular interest of mine, if you look at the bottom bullet on this slide, is to what extent either successful or not so successful failed case outcomes around child welfare might be mitigated or exacerbated by professionals working with families in the child welfare system by their experience with secondary trauma. Really, there's the individual professional and what the impact of this work on their health, but then to what extent, taking it one step further, this might have an impact on the ostensible outcome, which is the result of a child and their family being in the child welfare system. So like multiple steps along the line of inquiry. Next slide, please. And one. Great. So we used two methodologies here. The group model building, I'll talk about both in a bit, but the group model building was more to help test out some concepts that then we would, based on those results, we would then incorporate into the key informant interviews, which were really the primary source of data. And so what we did in terms of those is that we looked at child welfare and the different categories, occupational categories of professionals in the field. We broke down our interviewing stratification by those in departments of social services and child protection services, mental health providers, the education sector, the sector that has to do with advocates in the field, and then finally, the sector that is some combination of law enforcement, legal services, juvenile justice. Next slide, please. Right. So group model building, what we did is we took advantage of a conference that was taking place, bringing together stakeholders engaged in child welfare, and had an abstract accepted that proposed doing this group model building workshop. It was virtual. We used the Google Jamboard, and we really wanted to get feedback from a wide range of stakeholders into the field in terms of what they thought about the potential benefits or detrimental aspects of increased integration or collaboration in the field, what facilitators and barriers to that might be, and what additional recommendations they might have. Next slide. This and the next slide, I am not going to go into great detail, but I just wanted to give you a visual sense of what this process might look like. Virtually, using the Google Jamboard, we were able to get folks to do what they might do if they were all sitting in a room with a whiteboard or using Post-its and sort of workshopping different input that they might have. In this case, this is just a select group of feedback that we got on what folks thought increased collaboration or integration of services might do in terms of, pros and cons for helping families. Next slide, please. And this one, to the extent that there might be some support for integration, and in the previous slide, we were fairly surprised to see that there were a lot of downsides to collaboration that were articulated. But if we look at, okay, well, let's focus on what the upsides might be. Then we asked about facilitators and barriers to achieving greater collaboration across occupational or agencies. Next slide. And again, so it was from this initial data that then we were able to construct or develop our semi-structured key informant interview guide. The domains are listed there below, about 6 or 7 different domains of questions that we asked. We conducted 22 about hour-long Zoom interviews with individuals across these 5 across the 5 occupational categories that I mentioned before. And what I'll present next is just a brief overview of those findings. Next slide. Okay, so the first of 5, in terms of themes, as far as professionals working in child protective services or departments of social services. You can read in the middle where we have what the main themes were, and then on the sides are just select quotes from individuals. Essentially, around CPS, there's a lot of secondary trauma. Higher level folks might be able to detach, while, frontline folks, not so much, right? So they talked about, for example, the first response is dark humor, coping when they become callous. Workers get, quote, stuck, can't move tasks, prioritize, then there's sadness, crying, and a negative perspective. Very much on path to burnout and leaving the profession. On the family side, families know when a worker is, quote, checked out, has nothing left to give. It does impact families. So that just gives a quick view of sort of the spectrum, if you will, the extremes of what experiencing secondary trauma among professionals, might look like and might result in. Next slide. In the next sector, which had to do with professionals in mental health, they talked about collaboration being important, but there are certain barriers to that. Experiencing secondary trauma would, among other things, impair executive functioning among professionals in the field, and that it's not just trauma, but just systems issues that may prevent or may exacerbate the occupational, negative occupational exposures. Next slide, please. In terms of the advocates we spoke with, they focused very much so on professionals focusing a lot on, more so on, or maybe extremely or excessively on neglect as opposed to abuse, and how abuse in the system is a very small fraction of reports, and that neglect oftentimes poverty gets equated with neglect, so that is certainly the experience that advocates focus on, but certainly individuals working in this field would find themselves trapped in that as well. For example, having to act on reports around neglect when they felt that it may have been more the social circumstances and the poverty the families are living in, and not so much poor or bad behavior on the part of parents and families, for example. We can move on to the next sector that we spoke with, which were professionals in the legal and law enforcement side of child welfare. They recounted that professionals in this field would experience, feelings of helplessness, inaction, absence of closure. That much of what's going on and that could prevent what's going on with families is largely outside of their purview, hence the helplessness. Many professionals, or maybe not many, but some professionals in this field might have the opportunity to participate in crisis intervention training. And that involves working with other sectors. It has been shown to be effective, but certainly is not the rule, has been the exception. So I'm just looking at the quotes here to see if there was anything else. I guess the quote on the left, one thing about crisis intervention teams is that it allows for community collaboration, and that's huge. So that was certainly coming from a perspective that more collaboration among sectors and the professionals working in those sectors would be beneficial. Okay, and then finally, the last and fifth sector of individuals that we spoke with, next slide, please, is in education, largely special education professionals who interact a lot with families that might be involved in the child welfare system. And there was a lot of commenting there about the lack of resources to adequately address students' needs. Education for sure is a priority, so resources that can help families dealing with this, as well as the professionals themselves in helping families deal with it, are severely lacking. High rates of burnout, and just leaving the field entirely. Just to read that quote there, the secondary trauma and burnout are real. There's never been such a high turnover in the profession of educators, whether they're teachers or psychologists. And the other quote I thought was quite salient. I don't know if we ever get through it. We, the professionals experiencing the trauma, I think it just becomes like like scar tissue. It's just always there. Next slide, please. So just wrapping up, I guess, summing up our early findings, we're still analyzing, the data, these 22 transcripts. It was clear that not all workers receive services for secondary trauma and related conditions. In many cases, it is largely, kind of very much self-help, mental health day, training, a little workshop on mindfulness, yoga, that kind of thing. Intersectoral collaboration might be more likely among higher level, executive level staff, and dependent on funding or lack thereof. Collaboration isn't always beneficial, and they pointed out the impact potentially on families. I've said some of this already. I think the last one, the need for fluid funding streams, community engagement, and very important, leadership at high levels of organizations would likely be required. Next slide. And so finally, we will continue to analyze the data and specifically stratified data analysis, continuing on what I just presented across different occupational groups, and with the goal of developing a draft framework and how to address this issue at a larger systems level. I think that's it. Next slide. Thank you so much for your attention. And again, our great appreciation to the ERC for funding this work.